All right, welcome to the final segment about work cover related um, organizations and injuries and how to manage clients on them. You would have remembered that in module one, I talked about that there are many other providers of work cover insurance other than Work Cover Queensland themselves. And I mentioned some other names such as FPS, InjuryNet, EML, and BioSim. So we're going to quickly run through each one of those so that you know a little bit about each one. Again, this is just intended as a bit of an introduction so that you know the names and roughly what to do when they do pop up. But obviously, when it gets around to managing these clients for the first time, you can ask your supervisor for information and guidance around how to manage each one. All right, so we're going to start with FPES. So like I was saying before, this is Woolworths Group's chosen workplace injury insurer. So just like Work Cover Queensland, but a different name, it's called FPES. It does work differently to Work Cover Queensland. So unlike Work Cover where you get 5 initial sessions automatically approved, FPES only gets 4 sessions automatically approved. Admin are all over that, so they'll make sure that the counts are correct when somebody first comes to us under FPES. It works a little bit different in terms of the admin side for practitioners as well. So any treatments that you do and consumables that need to be billed actually need to be recorded in what's called the FPES provider portal. So this is a little login that you as a practitioner get access to. And so when a employee from Woolworths comes to access treatment from us, they'll be added to our provider portal as a patient, which you can log into. And your job in that provider portal is to make sure that you log that they've been for treatment, and there's a few questions and things like that that you need to answer every single time that they come in. So consumables need to be recorded in there. So if you're giving someone, say, a TheraBand or things like that, unlike Work Cover where you call for approval, you actually just pop it into the provider portal so that if there is a product on an invoice that we send, that it's accounted for in that portal, because they will match it if that product is not shown on the provider portal, but we invoice for it, it won't get paid for unless you've logged it in that portal. The cool thing about FPS is the physio is actually in charge of somebody's work capacity or duties, and you actually log those in the provider portal as well, which I'll show you in a second. Now, the downside to FPS, in my opinion, is that if you do need more than 4 sessions, which obviously for most musculoskeletal injuries, you are going to need more than 4 sessions, the claim is actually then referred to their secondary company that kicks in, which is called Employers Mutual, or EML is what people refer to it as, which we'll go through in a second. We're just going to talk about this provider portal first. So the link is there. medisupport.com.au/account/login. Your username will just be your first name and last name with a capital, and your password will be in your onboarding pack. You do, however, need to have your provider number before we can apply for this for you. So if you're starting with us as a new graduate, then you may not find it in your onboarding pack, because we need to have your registration and provider number back by then. But you will be issued with a login once we do get your provider number back from Medicare. Now, during your consultation, you do perform your consultation just as normal, like we do for all of our new clients. But I always encourage you to make sure that you log in to the provider portal for people who are going through FPS so that you can answer the questions that it asks you directly to the client, so you're not having to, think of what the answer would have been later in the day. So I normally do this either right at the start or right at the end of the treatment session. So you just log in, and this is what it looks like when you first log in. So, it pops up first a list of patients. So you obviously click on the patient that you're seeing, and then it comes up with something like this. So often it'll ask you for a pain rating out of 10, your function rating out of 100%. So I'll ask the patient, okay, from 0 to 10, how is your pain today? And you can explain that in more detail to them if they need it. And then I say, so out of 100%, if 100% is you're functioning just as normal, and then 0% would be you're dead, what would you rate your function at? And they will give you a percentage that you can pop in there. You ask them, in your opinion, are you improving, not improving, or stable? I think are the 3 options in that drop down box. And then in your words, what is your current work capacity? So do you feel like you can go back to work full duties? Do you feel like you can do your full hours but modified duties? Do you feel like you can only do modified duties but only part of the hours, or just no work at all? So that's trying to work out whether the patient's opinion matches up with what the practitioner believes as well. So you always make sure you ask those 4 questions of your FPS clients each time that they come in. Actually, I think it asks these questions every second time. So if you log in and click on a patient and they don't appear, that's okay. They probably will appear in the next one. It will also ask you questions about the person's progress and capacity. So how many total sessions do you believe this person will require? What's your opinion on their progress? So just comparing to the patient versus you. When you believe their expected recovery date is, and what your recommended work capacity is. And again, those capacity questions options in the drop down box are very similar. So it's either full duties, full hours but light duties, but part-time hours, or no work at all. Depending on what you select in there, sometimes it will prompt you to fill out like a work capacity questionnaire, which is where it'll break down each movement and ask you to say, okay, how many kilos can this person do? What can they lift overhead? Can they lift to shoulder height? Yes, no, or sometimes. So you just follow the prompts. It's very, very easy system to use. Once you go from one section, it'll automatically guide you to the next. But if you have any issues with answering the questions, obviously ask your supervisor. Also, just keep in mind that if the person has an injury that you do expect to take more than 4 sessions, or particularly more than 6 sessions, it is a good idea to make sure that you answer that accurately in the how many total treatment sessions do you believe this injury will require. Because what they will do is, if it is a big injury that is almost guaranteed going to take more than 4 sessions, they will often start their EML claim straight away. If you wait until the end of the 4 sessions and then start an EML claim, or they start an EML claim right at the end, it can sometimes take 2 weeks for EML to approve their side of things. So which means that they have a 2-week break just when they're needing their sessions. So it is worth putting in there realistically what you think it's going to take. If you think it's going to be more. Now, on the next section, so this page here is the next section that we will ask you in the provider report. So you can see there a section about consumables. So that's where you pop any, TheraBand, heat pack, spiky ball, weights, whatever it is that you're providing. It's just a drop down box. It has a big long list of different consumables that are commonly provided. So it'll ask you to select one of those, and then it'll prompt you to put a price in there. If you don't know the price, which none of us ever do, I still don't know the price of my own products at my own clinic, just see front desk so that they can give you a price so that it's correct. Because again, whatever goes in there needs to match the invoice that admin send out to FPS. So it is important to put that accurately on there. It will ask as well about these observations. So things like if the patient has poor compliance to treatment or exercises, overprotection, symptom magnification. These are all your yellow flags. So FPS is really good in terms of picking up on any yellow flags that a client has. So obviously, if you have any yellow flags that you believe will significantly affect someone's ability to rehabilitate, then you can pop it in there. And sometimes they'll action it and sometimes they'll just leave it and monitor. But certainly if you select things like that are workplace related, like a workplace conflict, Woolworths will actually start to action that. So just be a bit careful that you're not just mindlessly ticking those things, because Woolworths will action some of the things on there. So just make sure that, again, that it's accurate what you're putting in there. Now, if you need somebody to get a referral, for example, for an X-ray, ultrasound, whatever it is, or you think that they need to see a medical specialist for an opinion for whatever reason, then you can tick it in there, and FPS will arrange that on their end. Now, then it'll send you to this section here where you can write treatment notes and message to employer or doctor. So treatment notes is really just a record of your own treatment notes. I just copy and paste the treatment notes from the practice management system into there. They're exactly the same. They are obviously accessed by FPS. You need to just make sure that it's okay, whatever you're writing in there. But in the message to employer or doctor, this section here will actually send a message to the client's supervisor at whichever store they're from. And then if a doctor's involved, they will also have access to it there. So FPS is good in the sense that you don't need to necessarily send letters back and forth in order to communicate different things. You can just pop the message in there. That way you're keeping everybody up to date. Once you're done answering all the questions, you just click the submit report and it all goes through and everybody has access to their various parts of the client's information. Now you need to do this report on the day that the client sees you. If it lapses more than 24 hours, FPS has it in their provider contract that they're not required to pay for the session if this provider report is not completed within the 24-hour period. So if you do not complete this, you are again at risk of us not getting paid for that session that you've completed. So it is vitally important. They're very, very onto it as well. We have had a lot of incidences in the past where a practitioner has waited till the next day to do it, and we'll have phone calls the first thing the next morning saying, why is that report not completed? They need to do it on the day. So this one you need to treat just like clinical notes. It really needs to be on the day. But on the plus side, it is very quick and easy to do. So just make sure that you're doing that straight away. Now, if the client is needing more than 4 sessions, that's when they need to get referred to EML. And I just would like to say they are very good at resolving claims. So it is vitally important from an admin perspective to check the claim is actually open before proceeding with treatment. So doing the admin checks for the admin people that are watching this is extremely important when we're dealing with an EML claim, because they are particularly good at closing claims, which means that if the case is closed, it means that we're obviously not going to get paid for any treatment that happened outside of those dates. So this company EML works very similar to an insurance company, like a third-party insurance company, similar like when you have a vehicle accident, that sort of thing. They really only approve the initial session under EML, and then any further sessions need to be improved in writing from EML. So the best way to do that is to use a PMP or a provider management plan, which again, we're going to go training on that later in a separate module. Okay. All right. So if there's any questions at all about EML or FPS, please let your supervisor know. But just to recap, they're basically Woolworths' version of Work Cover Queensland. You get 4 sessions under FPS. It's vitally important that you fill out the provider report on the day that you see these people. If they need more than 4 sessions, it goes to Employers Mutual. And for that, you only get the first session approved. Anything after that needs to go on a treatment plan, which is in the treatment plan module that you can watch. And from an admin perspective, it is very, very important that you're making sure that anyone who's claiming to come in under EML, that their claim is actually active and open. Otherwise, we may well not get paid. Okay. All right, so moving on to BioSim. So BioSim is Bunnings' chosen workplace injury insurer. This is a pretty cool company. I quite like BioSim in some ways. BioSim actually give their staff 3 sessions to work on non-work related injuries as well. So the thing to know about BioSim is there are going to be some people that come in on BioSim that work just very similarly to Work Cover Queensland. If they've been injured at work, it's very similar. And then there are going to be other people that come in to do their non-work related sessions as well. So an example of that, if somebody works at Bunnings, they get they're playing footy on the weekend and they sprain their ankle. It has nothing to do with their work, but it's affecting their work. Bunnings will allow them to actually have some consultations, 3 consultations to help them rehabilitate from that injury that they've had in order to help their staff members stay healthy at work, which is pretty cool. It does work a little bit differently in terms of how it all starts. So the injury is reported to a supervisor, or a supervisor might notice somebody who is injured. What happens is they put in a claim with BioSim, and BioSim employ physios and OTs to do virtual health consults with the staff members before they actually see someone face to face. So what happens is that health practitioner will do a virtual consult with the staff member, and they collect basically the initial details about what they think the injury is, what their initial functional deficits are, and they'll do an outcome measure with them as well. All of that is included in the referral that you have access to, so make sure you have a good read of that referral when it does come through. Front desk will provide that to you either printed or it'll be in the client's file. So just if you've got a BioSim person, just see front desk and they'll be able to help you out with that referral and where to get it. Make sure that you read those functional gains, because you actually do need to report on how those functional gains, functional deficits. You need to report on those specific deficits in your report back to BioSim. So it's important to know what you're looking for and going to be expected to report on at the end. So the rules, whether they're work related or not, they get an initial 3 sessions, and it's always a requirement that you provide an end of treatment report. Consumables, unfortunately, are only billed up to $10 without approval. So if you do need to provide basically anything other than a TheraBand, you do need to ring them up and get approval for any products. After the 3rd session, you have to complete the BioSim report that's provided by front desk. Unfortunately, it is still a manual, fill it out with a pen style thing, which is a bit of a shame. But that's where you report on the outcome measures that were initially taken. So you need to do them again, and any recommendations going forwards. Now, for anyone who's non-work related, BioSim will not cover any further sessions. However, you can recommend to the client that they still access your services privately in through the clinic. It just wouldn't be funded by a BioSim. However, if it's work related, it is very similar to a work cover claim. You need to make sure that that recommendation is provided in the report back to BioSim. And what they do with that report, BioSim reassesses the claim. and they decide whether to continue funding treatment themselves, or they might choose to open up a Work Cover Queensland claim, which then obviously if they open up a Work Cover Queensland claim, then you're just dealing with work cover as per the work cover module. Front desk will be advised of this outcome in writing, and therefore they'll let you know as well. Okay. So BioSim is Bunnings. You might get non-work related, you might get work related. You always do 3 sessions and an end report, making sure that that report addresses those functional deficits that were on the initial referral. And then from there, it'll either become work cover or the patient pays privately for their sessions. Okay. And then the last one is Injury Net. So we're nearly there. So Coles Group, Wesfarmers use a company called Injury Net. It's kind of similar to FPS, but it doesn't have an online portal, unfortunately. But the rules are very similar. So 4 sessions are automatically approved. Anything up to $50 in terms of consumables can be provided without approval. If you need more than 4 sessions, then you have to fill out a provider management plan, a PMP, which again is going to be in a separate module on how to fill that out. So we would submit that to InjuryNet, and they will reassess the claim and again decide whether to open up a Work Cover Queensland claim or to close the claim. So pretty simple with that. Okay. Now, again, I keep saying this, but any questions, please see your supervisor. In your orientation, we'll check to make sure this information is going into your head as well. So you'll have a chance to ask before you start seeing clients too. Also, in your onboarding pack, there is a little quick reference tab. Table, I should say, that covers all the main insurers that we deal with and what their relevant rules are. So that's a good little table to have handy somewhere at work so that if you are seeing one of the patients, you can see sort of what their approval process is like, how many initial sessions you've got to work with, and those sorts of things. But obviously from there, ask your supervisor for help. Okay, so next module I'm going to be recording is third-party insurance, which is all your motor vehicle accident stuff, which is also very important for you to understand. So I will see you in the next module. Okay, bye.